Health is something that unites us all on a fundamental level. We all care about health and we all want to make sure our community is healthy, our family is healthy, our loved ones are healthy.
A healthy community is when people feel secure. And you can't be successful if you're worried about where your next meal is coming from, if you don't have a roof over your head, if you can't get the proper medical care, especially in some of our neighborhoods that are more underserved, forgotten, or left behind.
In order to change a system that has been producing health disparities and negative health outcomes, that it's going to take a community to be able to address those challenges.
The California Health Collaborative focuses on making sure that we achieve health equity in communities all across California.
We provide programs from birth all the way through the whole lifespan. The California Health Collaborative are the boots on the ground. We are the ones in the home. We are the ones out in the fields talking to the laborers. We are the ones going into the schools, talking to students. This is so important we work together, that you have a total picture.
We can be a bridge, a connector. We're already in many of these communities providing resources, providing services, and so oftentimes we can help folks remove barriers for their participation to create that connection back to their elected officials.
The partnership between elected officials, community members, groups within the community who are advocating for change, I think that partnership is where the real power lies.
California Health Collaborative is really about partnerships. It's about identifying where resources are, where the needs are in a community, and to be able to connect the resources with the people that are most in need.
You want to get something done, if you want to make sure that there's an impact to be made, work with CHC. Everything that they do, they most definitely do for the betterment of addressing the real issues and addressing the real needs of the community.
Relationships are everything. If you try to go it alone in government, you will fail. We don't have all the answers. In fact, we have very few. But when we partner with organizations out there in a community, then that's when we become successful. That's when we're able to truly make an impact on the lives of people.
When we prioritize the issues of everyday folks, it makes our communities 10 times better. So it's important to have good faith players like the California Health Collaborative.
Whether you're a school board member, a county board member, a city council member, a mayor, a senator, or even the governor, we are a very trusted resource for you as you consider very serious and critical health policy decisions.
For too long, we as government start with our opinions, our ideas, and then we try to convince the community that we're doing what's best for them.
In my experience, when it's the top-down, one person said it and this is what has to happen, it doesn't work. But when it's, let's come together, let's work together, let's figure this out, the wisdom is in the walls and the people around us. Problem's only an opportunity for success.
One of the things that CHC brings to the table is a set of new glasses. You're looking through a different perspective. There's a real need to really understand what that issue is about.
When we take into account the different voices of different people that are actually representing the community to better serve their problems, we understand better the population as a whole.
Pointing out the problems to community officials, that's the first step in making a change.
The California Health Collaborative has been able to break that barrier and build that trust between community members and elected officials to where community members feel comfortable going to elected officials.
The people that are being dramatically impacted are coming forward to City Council, are coming forward to these issues and stating it from their own eyes.
It's definitely been eye-opening to be part of CHC and realize that I can advocate for my passions and beliefs.
We work with community to understand what you're going through, the limitations that you have, and where you can create change. A small community may not have the funding and the resources available to do the research, to be able to fund large implementation programs. We help you identify those resources. We want to make sure that everyone has access to good information.
I loved it when we had our first sit down. I was presented with a notebook full of data, full of research to show this is how we're gonna fix this issue.
We know that when a lot of people come to speak with you, they're telling you what the problems are, but they don't necessarily have solutions. We try to help you and the community identify real-life solutions to help enhance the areas in which you represent and where you live.
It has been so amazing to see all the work that they put in behind the scenes before the ID gets introduced to me so that I can then bring it forward.
It doesn't just end at the implementation or the creation of the policy. CHC has done a phenomenal job to follow up, making sure that things are being addressed and that this is something that's making a true, genuine impact.
As we listened to our community, we were able to make better decisions. We came to conclusions that we would have never come to without being able to simply hear what they told us.
Health care isn't just in the doctor's office. Health care isn't just in the hospital. We're all receiving health care 24/7, be it physical health care, mental health care, be it looking at the social determinants of health. We're all involved. It's universal. We need to have care that is equitable, that is timely, that is correct. And in order to provide that, you have to really know the community. By working hand in hand, we can be a resource, we can be an advocate to look at policy, to make sure that the policy isn't the problem.
They're bringing their passion into the topic. As leaders, we get an opportunity to take that passion and give it a platform and give it a place in which things can make some changes.
I come to California Health Collaborative and ask them, what can I do to help you and what can you do to help me? We've got to work together to make a difference in our communities.
Everybody should have a voice. If any of our people are left behind, ultimately it will have an impact on our entire community. Partnering with California Health Collaborative to be able to prevent that from happening, that's when we become a good community.
We are nonpartisan. We work with all parties and all groups to come up with what are the best solutions for the community when it comes to healthcare issues. So please feel free to reach out to us as a resource, a trusted resource that will give you information that is evidence-based, that is critical for your decision-making about important policy decisions that will affect millions of lives.
We are an organization of people for people. We are here for you.